Health headlines, an alarming new and deadly trend among COVID-19 patients in the ICU.
A new study has uncovered a link between patients on ventilators and acute kidney failure. Stephanie Valderrama reports that the sudden surge is putting a strain on hospitals and staff already stretched thin.
Ventilators were top of mind as COVID-19 cases erupted across the country. But one challenge doctors weren't anticipating, the need for dialysis machines, especially amid a pandemic caused by COVID-19, a respiratory illness.
It's actually one of the highest complications that we're seeing.
As hospitalizations surged in New York in February, doctors began reporting a need for more dialysis machines, leaving hospitals scrambling to meet the demand. Here in Florida, Delray Medical Center was ready.
There was a time, I think, we got a little worried, but our hospitals have been extremely prepared.
The spike in COVID-19 patients needing dialysis caught the attention of Kidney International researchers, who launched a study of more than 5,000 coronavirus patients in New York hospitals. The study uncovered 1/3 of patients on ventilators experience acute kidney injury within a few hours or days, which, if left untreated, could lead to permanent kidney damage or failure. The rates in Florida could be much higher, according to Dr. Lon Sadowski.
Practically almost every 50 to 75%. Our rates may be higher because we have generally an older and sicker population. Many of the patients that I'm consulting on in the intensive care unit are requiring dialysis.
AKI is common among ICU patients, but what's concerning for physicians is the unusually high rates of AKI among COVID-19 patients with no underlying kidney disease.
And what we're seeing, unfortunately, is these large percentage of patients with healthy kidneys coming in and developing acute kidney injury, and probably 15 to 20% of them do not recover kidney function back to where it was before they started. And unfortunately, of those, maybe half of them do require dialysis indefinitely.
Stephanie Valderrama, CBS 12 News.